Welcome to the HormoneCyclopedia Podcast. I'm Dr. Richard Nkwenti, a compounding pharmacist, integrative medicine doctor, and a fellow in anti-aging, metabolic, and functional medicine. In today's episode, we have an intriguing discussion lined up. We'll be exploring the potential benefits of fenbendazole and artemisinin for cancer treatment, as presented by Dr. Tom Rogers, a medical doctor, in his recent YouTube video. Dr. Rogers acknowledges the effectiveness of traditional cancer treatments like chemotherapy and radiation, but believes there is room to consider alternative approaches. He highlights the promise shown by fenbendazole, a deworming medication, and artemisinin, a compound traditionally used in Chinese medicine, in treating cancer. It's important to note that these alternatives are not substitutes for conventional treatments and should always be discussed with a medical professional. Dr. Rogers will delve into the mechanisms by which these substances are thought to work and provide insights on potential dosages and side effects. Stay tuned for a fascinating discussion that bridges traditional and alternative medicine in the fight against cancer. Let's get started.
Okay, so you've been seeing this fenbendazole thing popping up everywhere online, huh?
Seems like it's the hot topic these days.
It's like everyone's suddenly talking about this anti-parasite medication as a potential cancer treatment.
Definitely caught my attention.
But, as always, we got to be careful about what we believe, right?
Absolutely. Especially when it comes to something as serious as cancer.
That's why we're doing a deep dive into all the research you sent us. We've got a video from Dr. Tom Rogers. He's a physician who's really into alternative cancer treatments. And there's that research paper straight from the labs at Yale, plus some articles about the whole world of drug repurposing.
It sounds like we've got our work cut out for us.
We do. So let's jump right in and see if fenbendazole is the miracle cure some people claim it to be, or if it's all hype. What do you say?
Let's do it. But before we get too deep, I think it's important to start with a little disclaimer. We are not medical professionals.
Right. We are definitely not doctors.
Anything you hear in this deep dive is for informational purposes only. And it should never, ever replace the advice of a qualified healthcare professional.
Couldn't agree more. Always talk to your doctor before making any health decisions.
Okay, now that we've got that covered, let's talk about Dr. Rogers. He sees a lot of patients seeking alternative treatments. And in this video, he shares some anecdotal evidence, basically just individual stories and observations, that suggest fenbendazole might be effective, particularly when it's used alongside traditional cancer therapies.
He even mentions this guy, Joe Tippin. Remember him?
Yeah, his story's hard to forget. Diagnosed with terminal lung cancer back in 2017, right?
Yep, back in 2017. And he started taking fenbendazole, and get this, he's still cancer-free today.
It's definitely an incredible story.
It's those kind of stories that give people so much hope, you know?
Oh, absolutely. It's completely understandable why stories like Tippin's resonate to people, especially those who are facing a cancer diagnosis. But here's the thing.
There's always a but, isn't there?
Well, in the name of being thorough, we have to remember that this is just one case, and we can't definitively say that fenbendazole was the sole reason for his recovery.
True, there are always other factors at play.
Exactly. There are always other factors involved, like lifestyle changes, other treatments he might be receiving. We just don't have all the medical details.
Yeah, it's easy to get caught up in those feel-good stories and want to believe there's a simple solution.
For sure.
Huh.
But we have to be careful about jumping to conclusions.
And then there's the fact that this supposed miracle cure is actually a dog dewormer.
Right. Readily available over the counter.
And it's been around since the 70s.
That's the wildest part. It's not some brand new high-tech drug.
And to top it all off, it's super cheap.
Which just adds to the whole mystique, right?
Totally. But how does it even work? Like, how could a dog dewormer possibly have these effects on cancer cells?
That's the million-dollar question, isn't it?
It's like something out of a sci-fi movie.
Right. Well, Dr. Rogers actually goes into some of the science behind it. He says that fenbendazole might work in a couple of different ways. First, he says it messes with the structure of cancer cells, making it harder for them to divide.
So it's like it's disrupting their ability to multiply.
Exactly. And this is actually similar to how some chemotherapy drugs work, which is interesting.
Huh. So it's not a totally crazy idea.
Not totally. But then there's the second way fenbendazole might work, and this one is really fascinating.
Okay, I'm intrigued. Lay it on me.
So cancer cells, they love glucose, right? They gobble it up to fuel their growth. And what fenbendazole seems to do is interfere with their ability to take in glucose, essentially starving them.
Wow, so it's like cutting off their food supply? That makes a weird kind of sense.
Right. It's like No more sugar for you, cancer
I
cells.
like it.
But as with everything else we've talked about, more research is needed to confirm these mechanisms and to see if they actually translate into real-world results.
Because let's be real, it still seems kind of crazy, a dog dewormer having these effects on cancer.
I hear you. It definitely seems counterintuitive. But that's the thing about science, right? There are always new discoveries that challenge our assumptions.
And speaking of science, let's talk about that Yale study you mentioned earlier. They weren't just looking at anecdotal evidence, right?
No way. These researchers were not messing around. They took a deep dive into fenbendazole's effects on a specific type of breast cancer cell called EMT6 cells. And these cells are often used in research because they're pretty well understood.
So they weren't just looking at this in a vacuum. They were using a controlled environment to really test this out.
Absolutely. They used really rigorous methods to test fenbendazole in a few different scenarios, by itself, in combination with radiation, and then alongside a common chemotherapy drug called docetaxel.
Wait, docetaxel?
Yeah, it's often used to treat breast cancer, so they wanted to see if fenbendazole could enhance its effectiveness.
Kind of like, let's throw everything at it and see what sticks.
Exactly. Unfortunately, the results weren't what many people, especially those who believe in fenbendazole, were hoping for.
This is where the excitement fades and reality sets in, isn't it? What did they find? So no miracle cure then?
Sadly, no. The Yale study, unfortunately, found no evidence that fenbendazole, even at crazy high doses, was able to slow down that tumor growth or make the radiation therapy any more effective.
Wow. So even with all those different ways they tried it, like by itself, with radiation, with the other chemo drug, nothing changed.
Yeah, pretty much.
That's a bummer. It's definitely a reality check, especially after hearing those glowing anecdotes. But I guess that's the thing about scientific research, right? It's all about testing those hopeful possibilities, but in a controlled way. And in this case, what they say. The study suggests that fenbendazole is unlikely to be effective as a standalone cancer treatment, right?
Yeah, that was one of their main takeaways.
Okay, so you've got Dr. Rogers over here seeing some, promising results in his practice, but then we have this very official-sounding Yale study that seems to throw cold water on the whole thing.
It's definitely a head-scratcher.
It is. It's enough to make your head spin. How are we supposed to reconcile these, contrasting viewpoints? What are we supposed to believe?
Well, that's where it's helpful, I think, to zoom out a little bit and look at the bigger picture of this whole drug repurposing thing. Do you remember those articles you sent about the challenges of repurposing drugs?
Yeah, vaguely. Refresh my memory.
They highlight just how complicated this whole process can actually be.
Drug repurposing. For those who, need a refresher, that basically means taking a drug that's already approved for one use and finding out if it can be used to treat something else entirely, right?
Exactly. Like using a heartburn medication to treat, say, migraines.
Interesting.
It sounds like a pretty simple concept on the surface. Take this thing that we already know works for this, try it on that. But it's a lot more complicated than it seems. A lot of it comes down to cold, hard cash.
Because pharmaceutical companies are businesses at the end of the day.
Exactly. Developing a new drug from scratch, it is wildly expensive.
Oh, I believe it.
We're talking billions of dollars.
Billions.
Years of research, clinical trials, the whole 9 yards.
It's a whole undertaking to get a new drug to market.
It is. And companies are only willing to take on these massive financial risks because if the drug is successful, they get that patent.
The patent.
Which just gives them, exclusive rights to manufacture and sell that drug for a certain amount of time. And that's how they recoup their investment and hopefully, make a profit.
Makes sense. Got to see some return on all that time and money.
Absolutely. But here's the thing with a lot of these repurposed drugs. They're often off patent.
Because they've been around for a while.
Exactly. Like our friend fenbendazole.
So anyone can just make it and sell it.
Pretty much. No shiny patent, no big money to be made. So even if there is really compelling evidence that a drug like fenbendazole could be super effective for, say, cancer treatment, pharmaceutical companies just have very little financial incentive to pour resources into doing more research, more trials to get it approved for that new use.
Because they can't control the market on it anymore.
Exactly.
So even if a drug shows promise for a new use, this whole financial reality is just like a roadblock.
You hit the nail on the head. It's one of the big ones. It's a frustrating situation for everyone, but especially for patients who are, seeking new treatment options. And then on top of that,
There's more.
There's this whole other thing to navigate.
Okay.
The regulatory maze.
Oh no, not the red tape.
Oh, yes. Getting a drug approved for a new use, it's not as simple as just being like, hey, this might work for something else too.
It would be nice if it were that easy.
It would.
Yeah.
But you're right. Even if a drug is already approved, considered safe for one use, getting it approved for a new use requires going through this whole new, very lengthy, and yes, expensive approval process.
So you basically have to treat it like a brand new drug, even if it's been around for, decades in fenbendazole's case.
Exactly. More research, more trials, more hoops to jump through. And all of that takes a significant amount of time, money, and resources, which, as we discussed, most pharmaceutical companies just aren't willing to invest when there's no guaranteed return on that investment.
It's really starting to make a lot more sense why we see these, potentially promising drugs kind of stuck in this weird limbo.
Yeah, it's a complex issue with no easy answers. On the one hand, we have this potential for existing drugs to offer new solutions for really difficult to treat illnesses, right?
Right.
But on the other hand, navigating the financial and regulatory hurdles of drug repurposing, it's a daunting task.
This is a lot to process. So where do we go from here? What does it all mean for, me, for anyone listening who's trying to make sense of all this? So where does that leave us? It's like, on the one hand, you've got these incredible stories about fenbendazole, like it's doing something amazing. But on the other hand, we have this very official study that's like, not so fast. And then on top of that, trying to get a drug repurposed seems like an uphill battle.
It's definitely a lot to wrap your head around. And I think it really highlights how important it is to be, well, a little skeptical when you're looking at health information, especially online.
So no more blindly trusting those social media miracle cures.
It's always best to take a step back and really think critically about the information. Look for credible sources. Be aware of potential biases. Don't be afraid to dig a little deeper,
Easier said than done sometimes. But I get it. So if we boil all of this down, what's the key takeaway for our listeners? What's the bottom line on fenbendazole?
Well, I think based on the information we have right now, the scientific evidence to support using it as a cancer treatment is still pretty weak. That doesn't mean it's definitely not effective.
Right.
But we really need more research.
And more robust research at that.
Exactly.
And while those anecdotal stories, those personal experiences can be really compelling, we just can't rely on them as proof, right?
Unfortunately not. What works for one person may not work for another. There are so many different factors at play. We're all unique, and our bodies can respond to treatments in very different ways.
That's why it's so important to talk to your doctor.
100%. Your doctor knows your medical history. They know your current health status. They can give you personalized advice that's based on the most up-to-date research.
Right. We say it all the time, but it's always worth repeating.
Absolutely. They can help you weigh the potential risks and benefits of any treatment option, whether it's a traditional approach, something like an alternative therapy, or even a drug that's being investigated for a new use, like we've been talking about with fenbendazole.
So at the end of the day, it really boils down to this. Stay informed, be cautious, ask questions, and talk to your doctor.
Couldn't have said it better myself.
Okay.
It's your health, and you deserve to feel empowered to make the best decisions for your own body and your well-being.
Well said. And on that note, this has been a fascinating deep dive. We went from exploring this potential cancer treatment to uncovering all the complexities of drug repurposing and the challenges that come with it.
Yeah, it's definitely more complicated than it seems on the surface.
It really is. And there's still so much more to learn, which is both exciting and a little daunting,
Oh, for sure. That's the beauty of science. It's always evolving. What we think we know today might change tomorrow with a new discovery or a new study. And that's exciting.
It is. It means there's always hope. Well, that's all the time we have for our deep dive into the world of fenbendazole. Hopefully you found this exploration informative and, maybe it sparked some more questions for you.
Yeah, keep those questions coming. Keep exploring. Keep the conversation going.
And until next time, stay curious.